Rich. Welcome to the Thinking Physio podcast. My pleasure to have you on.
How's it going, Avi? Yeah, I'm happy to be here.
Pretty good. Thank you. So first off, I just want to thank you for taking some time off on your Sunday to sit with me and chat a bit. And for some of my listeners, I just wanted to give you guys a brief intro about Dr. Rich. Dr. Rich is a doctor of chiropractic medicine. He is a business owner. He is a teacher. He juggles a bunch of different hats. And the reason I wanted to bring him on was, first off, he's the first chiropractor who's coming on the Thinking Physio podcast. And I wanted to bring in people who are like-minded in certain ways. Like, if we believe in the same principles in rehab and in our industry, they don't exactly have to follow like my line of thinking. But if we agree on certain things, I'm genuinely intrigued. And our first interaction, like the first time I went into and Dr. Rich interviewed me, was really interesting, which made me think like, I think I'm at the right place, because we will talk about a bit more. But I don't know if you remember this, Dr. Rich, but I think one of the first questions you asked me in the interview was, you're like, I'd love to see how you work, because you're not big on setting people up on modalities and, then like seeing other people really fast. So as soon as you heard that, my mind was like, okay, I think I'm at the right place, because now after having given a bunch of different interviews, there are certain things that I kind of look forward to when working in a clinic. And as soon as you said that, I was like, yeah, this is going to be interesting. Since then, I've had some chance to like work with you and, get to know you and pick your brain a little bit. So that's why that was the reason I wanted to have you on and, share some of the stuff that you're doing, which is pretty exciting, and have some of my listeners get a piece of what you're into.
Yeah, and likewise, Abhi, I think the impression went both ways. I think as soon as I started talking about what I'm trying to do, I think I saw your eyes light up, and I thought, okay, I think he's interested, because it seemed like you said, we've chatted a couple of times, and it seems like we're very like-minded. Right. I think it's awesome.
Yeah, exactly. Awesome. So I wanted to start with, I've had some episodes on the podcast where I'm talking about like very sciencey stuff, but I have other mediums to do it. And this is more like a casual podcast where I just want to like chit chat and know a little bit more about like your journey and, understand like how did you decide to be a chiropractor and stuff like that. So I guess that would be the first opening question is, so what made you gravitate towards becoming a chiropractor? Was there something that had kind of pushed you towards this field, or you gravitated towards being a chiro?
So not really. It was a total accident, a complete accident. I've never been to a chiropractor until I became one.
Okay.
I had never been adjusted. I had never seen a chiropractor. So it was a total fluke, actually. When I did my undergrad at the University of Waterloo in kinesiology and cognitive science. And I actually had been accepted to pursue my PhD in neuroscience at the University of British Columbia and UFT. And I thought I was decided on going to University of British Columbia for my PhD. And it was actually my supervisor, who I was doing some neuroscience research with in Waterloo, who I was with him in the lab, and I get an email, hey, you got accepted to chiropractic school. And he looks at me and he says, oh, congrats. And I wasn't even like that excited, because I was determined to go into neuro. And he was the one that told me, look, I think you should go down that path. And the reason why he said that is because I always wanted to teach. I still want to be a professor at some point. And going down the academia route is that you're in school, getting your postdoc. Who knows where you'll end up teaching? Who knows where you'll do your PhD and postdoc? So to me, it was a lot of instability. And I personally like a little bit of stability, at least. So to me, it just kind of fell in my lap. And funny enough, I was actually, when I was in third year, one of my good friends, he doesn't even know this, by the way, his name is Patrick. And we were talking about applications and what we're doing after our undergraduate degree. And he said to me, hey, I'm doing this chiropractic thing I'm applying to. This is before I even applied to chiropractic school. And I didn't even know what chiropractic was. And I thought, oh, what is that? And he started telling me about it. And I thought, oh, that sort of sounds like physio kind of, but not really. I'm going to look into it. Anyway, long story short, I ended up applying the following year and ended up getting in. But prior to applying, I was also considering being a physio. And during that time, I actually dislocated both my shoulders. And so I was actually seeing a physio. And honestly, Abby, I think it was that experience that almost leaned me away from physio, because it wasn't a very good experience for me with that particular physio. And when I started looking into the chiropractic curriculum, I didn't know what they did. I just looked at the courses and I loved it. It was very focused on anatomy, neurology, neuroscience, and that's all the stuff I love. And so I thought, you know what? I'm just going to go into this program. I don't really know what they do, but I love what they learned, and so that's why I'm here. And so I mean, you and I have talked a bunch of times, and to me, like, I don't care to be called a chiropractor, right? I'm a therapist. And so, what your title says, what your degree says is one thing, but how you practice is really what matters. And so, yeah, I'd never been to a chiropractor, but I saw what we were able to do, what we were capable of doing, and what we were taught. And I thought, this is perfect. I can combine all those things, and there's so much I can do, and so many different styles that I can take. So that's basically how I became a chiropractor. Total accident.
Interesting
Yeah.
story. And I find like interesting point that you said here was, I guess, couple of years ago, the boundaries between like what a chiropractor did and what a physiotherapist did were clearly defined. But I feel like in the last couple of years, things are becoming a little more blur, right? Because we seem to be kind of overlapping in the things we do, which necessarily I don't think is a bad thing, right? Like you said, I don't care about being called a physiotherapist or two, right? Like before I knew a lot of chiropractors did rely a lot on adjustments and stuff like that. But now I see a lot of chiropractors doing a lot of like, including especially you, right? Like doing a lot of movement stuff, a lot of palpations. So it's not just like a in and out adjustment and stuff like that. So you're doing all those things that we do with manual and exercise, and you prescribe exercises as well. Plus, even in physio, we can take a special course and we can do some manipulations now. So we need to get roster to do that. But that makes me think like, aren't those boundaries a bit blur now on what we do?
For sure, 100%. But I don't see that as a bad thing. It actually surprises me and it shocks me how catty sometimes our people in our realm are. When you look at the utilization rate of chiropractic here in Ontario, at least, it's hovering between 20 to 24%. That's not a lot of people,
Yeah.
right? That's about 1 in 5 are seeing chiropractor. There's really no purpose in us, fighting each other, because there's still so many people out there that have no idea what we do. The utilization rate for physiotherapy is higher, but if chiropractors focus more on improving the perception of the profession, improving our collaborative efforts, that utilization rate is just going to go higher. And so to me, it doesn't make sense why sometimes it seems like we don't support each other. So yeah, even though that line between a physio and a chiro is blurred, so what?
Yeah.
Right? It really doesn't matter. As a matter of fact, I think that's a good thing. I think it's fine. I know physios are fighting for the doctorate, right? The title of being a doctor as well. So that will even blur it even more. But again, I don't see that as a bad thing necessarily.
Absolutely. And I think a lot of your practice kind of epitomizes this whole concept too, right? You want to bring in all these different practitioners, and you can provide a collaborative care for your patients. So all the I guess rehab specialists under one roof. That's a great idea.
Yeah, exactly. Yeah. And, there's also so much to the body that often enough we want to be able to treat everything, but it's very difficult to be an expert at everything. And so this is why having a team like what we're trying to do at Ottawa Health is so valuable, because there's many things that I know you're more comfortable with than I may be comfortable with. And even though we do very similar stuff, well, that is an excellent way of collaborating. And so there's plenty to learn about regarding the human body, right? There's so many different techniques to explore and so many different new approaches that are becoming more available every year. Seems to be something new. That again, there's a lot of room for collaboration and for growth. So I think it's good that we're starting to see more of the multidisciplinary clinics, and even more so that we're starting to get more physicians that are starting to be more advocate of that interprofessional sort of model. They want to work more in multidisciplinary clinics versus independent family physician clinics. And I think that's going to accelerate the efficacy of our treatments by a lot, right? Especially once we all get on the same page.
Absolutely, I agree. I wanted to delve back a little bit and talk about your bachelor's. Your bachelor's in, was it kinesiology you said, or exercise science?
Yeah, so it was kinesiology and cognitive science.
And
And
cognitive.
so it was a minor in cognitive science and the major was kinesiology.
I see. So I did my bachelor's in India, and in India you could join physiotherapy school right after high school. What that does is for us is we delve into the world of like rehab. Oh, actually, a first subject right out of high school is anatomy, physiology, biochemistry, and stuff like that. We don't have a great basis for exercise, and that's something I find which is a bit different to get into either physio school here in Canada or even to get into chiropractic school. You need to do your bachelor's, right? Which gives you a bit of a background into exercise and stuff like that. Maybe just talking about the basics, I guess, like, planes of the body, frontals, sagittal, stuff like that, talking about exercises, joint mechanics and stuff. I did my master's in exercise science, and so I went the other way. I finished my physiotherapy first, but I was like, I think I can like rehab people. I think I can rehab people, but I want to know a bit more about, like, say if somebody's now out of pain, how can I get their performance to be better, or like get some more knowledge on rehab exercise and stuff like that. So I went the other route, but I just wanted to know your experience with your undergrad degree, your kinesiology. How was that experience?
It was very, honestly, I have very few negative things to say about it.
Mhm.
The only downfall to my undergraduate experience was that I didn't really know where I was going. And whenever you have like a path, whenever you know where you're going, you feel more invested. Do you know what I mean? And
Yeah.
so when I was in my undergrad, yeah, like I was learning all this stuff and it was cool and I loved it, but I didn't really know where I was going. And so I didn't have as much of a passion to really, try to absorb as much as possible, I suppose. I guess my mind was also preoccupied about what I'm going to apply after my undergrad degree. But what really helped me was my personal background in sports as well. I had a lot of experience in mixed martial arts, which to me translated very well to what I do now. And I have, over 12 years of weight training. I used to do a lot of powerlifting. And even through participation, you start to learn a lot about biomechanics, right? Through trial and error, you learn a lot about anatomy when you're training your own body. And so that really benefited me. But I have to say, the University of Waterloo was a fantastic program in terms of kinesiology. My very first lecture was with Dr. Stu Mcgill, who is, a pioneer of biomechanics and spine health. And it was the most intimidating lecture because he doesn't mess around, and it was the first day of our undergrad degree. And he says, if you ever want a reference letter for me, don't you dare wear a hat to our class. Because if I see you with a hat in my class, I'm not giving you a reference letter. And everybody, all these first years are just looking at each other. You see guys take off their hats and put it on their laps. And then he says, by the way, I am Dr. Mcgill, not Stu. I'm Dr. Mcgill. I worked very hard for that title. So immediately you get that intimidation.
Right.
But it was just nice being able to learn from people like that. So it was definitely a very, very positive experience. But really where I learned the bulk of, I think, my passion and knowledge was definitely with the chiropractic school. Because at that point, you're invested 100% in what you're doing. And at that point, you have to become the best you can because you're paying a lot of money to be there too, right? So that's another element that makes you a little bit more driven, I think.
Is that a 3-year program?
The chiropractic one,
Yes.
it's a 4-year.
Oh, it's 4 years. And how about the undergrad? That's three or
Waterloo was 4 years as well.
okay, so four. Okay, I see. But I got to talk about Dr. McGill, I guess, a bit. Like, we in India grew up like reading some of his material, and we knew he was like one of those big heavyweights in the world of rehab. But everything you did describe about him, that's really interesting, because I had another colleague who was telling me his classes, she didn't really elaborate on what it was, but she's like, it's really interesting to be in one of his classes. And it sounds like he's a bit old school in terms of like manners and stuff, like, not keeping a hat and not wearing a hat indoors and addressing him in the right way. So that's really interesting. But I was wondering, there's something really interesting about him, right? He's not a physio or a chiro, right? Like, he doesn't have any medicine or medical background. Is that correct?
Yeah, I mean, he's in a way a therapist as well. Like he works with, Olympic athletes. I mean, I don't know if he still does necessarily, but he's worked with Olympic athletes. He's worked with a lot of people. And I wouldn't say he treats like we may, but he's very analytical from a biomechanical point of view.
Mm-hmm.
And that's really what he's an expert in, is optimizing movement to produce one efficiency and minimize risk of injury. But just to go back on something that I really learned from him, and this is something that I think I really apply in my life now, is how he evaluated students. So in his courses, you never get a multiple choice.
Okay.
Like it's not multiple choice, all written, because his lectures are hilarious. It's basically just him talking. You know, he'll put maybe 4 slides and then he'll talk and talk and talk, and then you're just writing as much as you can. But the good thing is that a lot of his lectures are based off the textbooks he's written, like low back disorders and performance. So you could always use those as a reference. But basically, you know, his exams are, 5, 6 questions, and you write a page's worth. And so it really gives you the opportunity to really think and see if you really understand what is going on. And I think that is so important, because a lot of the times when we're trying to, perform a particular therapy style or treatment style or protocol, we're almost performing what somebody else did on Instagram or in a seminar or whatever it is. But in reality, in my opinion, if you really understand what is going on, you can develop your own protocols and your own treatment styles, right? And that's something that I learned from him, is how to really read the situation and then develop a treatment from that. It's not about memorization, right? It's not about, oh, you see lumbar disc herniation. Okay, you have to do extension McKenzie's, right? Which unfortunately, a lot of people think that because that's how sometimes it's presented. But you know more than anybody that it's not as simple as just arch back if you have a disc problem, right? So that's kind of an example of what I mean. If you really understand, you're better at creating treatment styles. And that's something that he's very good at. And he pushes that as a professor. So definitely teaches you how to learn, which is valuable, of course.
Right. And I think for me, one of the big aha moments, since I never got a chance to like go through all his books, but I would like catch some of the, I guess, like the nuggets of what he was teaching from here and there. One of the things, like for me, the Eureka Movement was when he did that presentation with Gray Cook. I don't know if you've seen that one where they talk about like squat depth and stuff like that. So this was me, I think back in 2013 or something. I went to my first CrossFit gym, and for some reason, like I went to the CrossFit gym, and my instructor's like, "Hey, you got to squat with your toes pointing forward, and you got to squat with ass to grass, like cross parallel and stuff like that." And especially with the overhead squat, too, I could never do it. I would always struggle. I had to keep my feet wide. I tried to do all these kind of banded mobilizations to kind of, loosen my ankles up, increase my dorsiflexion, but I could never get it. And I'd always often get these nagging injuries in my ankles from like overstretching and stuff like that. And then finally I see this presentation where he brings in, like, he says, hey, sometimes squat is dependent on, actually a lot of times squat is dependent on your genetics. When I first heard that, it's like, what is he talking about? And then he brings in these models of like the way the femur is shaped into that acetabulum and stuff like that, and everybody cannot squat the same way. It's almost like a scientist kind of, looking at these things, and he's talking about how he'd seen a lot of cadavers and worked on them, and then he was like, hey, just because of the shape of our hips, we all cannot squat the same way. And I feel like that message has now in the last couple of years changed from, remember how a couple of years ago, everybody had to squat just one way. And now I think people are changing a bit where they're like, hey, you got to squat according to how, like, whatever your bone shape is or something, right?
Yeah, 100%. And it's funny you bring that up, because it's a conversation I have with my patients all the time. As a matter of fact, I have like on my computer saved like the diagrams that he uses showing the variability in the femur angle, the acetabular angle, femoral anteversion or retroversion. Because when people see that and they see how different one person can be from the other, they're so shocked, right? And even in our education, we're taught this is what a spine looks like. But that's it. They show you one spine. And then you got to think 8 billion people in the world look the exact same. That's ridiculous. If people have different skin colors, why can't they have different shapes to their bones or sizes or thicknesses or curves, right? It doesn't make any sense why we generalize sometimes like that. So yeah, you're totally right. I'm glad you brought that up, because it's a very important discussion to have with your patients or anybody that is trying to squat or perform any activity. because unfortunately, our anatomy determines our abilities, right? So yeah, you're totally right with that.
Now, let's talk a bit about your training history. I was going through your Instagram, which, by the way, I just found out like a couple of days ago that you also go by Dr. Rico, right? I saw your
That's my Instagram alter ego.
I see. I see. I was like, Dr. Rich or Rico, but I saw your Instagram, really informative stuff like on there. But I saw you like pulling a lot of weight. Seemed like a couple of years ago when you were big into powerlifting, right?
Yeah, yeah.
How do you get
It
into
was,
that? Like,
sorry, what was that?
how do you get into that? Just to give us a little bit of a history. I never mentioned that. I think in the intro, I should have also said athlete because you're pulling some serious weight there.
Yeah, I got into powerlifting or weight training, I would say, when I was in high school.
Okay.
I didn't really know what I was doing. I was just lifting weights. The reason why I got into it, I'll be honest, it's a bit personal, but I'm a short guy, right? I'm 5'6", and I thought, man, I'm 5'6". I gotta look bigger than that. So I gotta put on some muscle, and so I started working out. And yeah, I got obsessed with it. Feeling strong is such a good feeling, right?
Right.
And so I was also surrounded with guys that were very strong and really into it. And that's really what really propelled me to the next level. Because I never had a personal trainer or anybody teach me how to do things.
Right.
But it was working out with my friends in Waterloo who were all, very high level athletes that really set me apart. And then since then, it was all steady climbing. A couple of injuries along the way, and then COVID, basically limited us from going to the gyms, and I didn't have any gear at home. And so that really put a dent in my training. But I'll be honest, I did lose about 20 pounds since COVID, but I feel great. Like my joints don't ache. I'm way more flexible. Like I can do the splits again, which I could never do prior when I was deadlifting or powerlifting seriously. And so I actually feel great. My sleep improved as well. So, there's pros and cons to everything. And for me, I found out that being too heavy was not necessarily the best for my health. Like I developed severe sleep apnea. I was weighing 200 pounds at 5'6". So I was like a little brick walking around. But yeah, it was fun. I mean, the most I ever deadlifted was close to 600 pounds, and I was squatting 500 pounds. My bench press was never very good because I've had so many shoulder injuries that I could just never develop a good bench press. But the most I ever bench press was 295. But that was definitely what was lacking in my training. But no, I loved it. Powerlifting was awesome, just amazing.
Now, what was the goal though with this? Were you planning to like go to some meets, or was this more just for your own training, but you just like gravitated towards more strength training?
Yeah, it was just personal, really.
Okay.
I mean, I did consider doing a meet or two, but wasn't obsessed with it. I really enjoyed it from a personal point of view. For my mental health, it was fantastic as well. So it was just my sport, my hobby.
I see.
Yeah.
What about like during your powerlifting days? Was there some cardio involved, or was it generally just a lot of lifting?
What was, sorry?
Did you do some cardio as well, or like those days was just a whole lot of like lifting all the time?
No, I did try to do some cardio as well. I think that's just as important. As a matter of fact, it's very highly encouraged to do cardiovascular training when you're bodybuilding,
Right?
Because cardiovascular training does affect your capillaries and does affect your blood flow. And the more muscle you have, the more blood flow that you should be more efficient at utilizing. But I don't like cardio very much. I can't. And so I had to find ways to make cardio a little bit funner.
Right.
And I would do a lot of boxing. I would hit punching bags. I would do stuff like that, which is a little bit more interactive, I think.
Right.
But I hate treadmills and bikes, stationary stuff. I'm the worst.
Right.
It's so boring. Time just doesn't move. You're staring at the little clock in front of you. So I got to find a ways to do my cardiovascular training a little bit more interactively.
Right.
But yeah.
Is it fair to say that like since you're training so much on one attribute of fitness, which is just strength training, that you start to lose some of the other components of fitness with power training, like flexibility? Is that fair to say, or you know some
Yeah.
people who are like super? Because I've seen some people who are lifting like serious weight, but at the same time, like they're still flexible. But that's, I guess, like a smaller population, though. Like generally, I don't know. I have this perception. I know a lot of people have asked this question too, and they believe that doing a lot of strength training causes like maybe decrease in flexibility or mobility and stuff like that. What do you think about that?
Well, you see, that's a good question. my opinion on it is that I think the majority of people don't emphasize regular mobility as much as they do on the regular sport, which I was guilty of that. Because guys who are serious in bodybuilding or powerlifting, they're spending anything from 12 to 15 or 20 hours of weight training at the gym per week.
Mhm.
That's a long time. And so sometimes we neglect the recovery aspect. And that's the issue that I was having. I wasn't working on my mobility as much as I should have been. And that's what I see most in clinic. We become obsessed with the training, but not the recovery part. And so I think it's still feasible to have both, but it requires a lot of discipline. And that's the part that I think is a little bit tricky to accomplish. But I mean, from personal experience, yeah, of course, the more you stress your body, weight training, the more you start to see its effects, right? And that comes with aches. Your joints are a little bit sore every once in a while. But yeah, recovery is just as important, and doing the mobility work is just as important as the training as well, especially the older you get, right?
Mhm. And what about your history into martial arts? I know you mentioned a bit about that. What kind of like martial arts were you training?
Yeah, so I trained in Muay Thai and Brazilian Jiu-Jitsu.
Mm.
That was that was so much fun. It was one of the funnest times of my life, I think. I'm actually trying to get back into it here in Ottawa, but I'm waiting for a COVID situation to improve a little bit. But basically, I used to train in a gym in Toronto that the Muay Thai trainers were actually the trainers of a UFC fighter called Shogun Rua. And so Shogun Rua, we met him multiple times. We trained with him for a while. So there's a lot of big names that came through that gym. And I always wanted to have at least one amateur fight. But unfortunately, like my shoulders that's when they started really acting up. And I ended up subluxating both of them on different occasions. And now that I think back, one of the other things that I also used to do when I was in high school is I used to be a baseball pitcher. And I think that probably came into play in regards to why my shoulders were a little bit maybe not as healthy as they should have been for that particular sport.
Mhm.
So everything just started to break down in terms of my shoulder health after that. And, I started doing it just recreationally, but that's about it. But jiu-jitsu is one of the best sports I've ever participated in because it's everything. It's mental, it's physical, it's cardiovascular, it's strength, flexibility, mobility. Like it does it all in one particular sport. So it's fantastic. Really, really good sport.
I see. So most of your injuries were through fighting and not as much through powerlifting, were they?
Yeah, that's fair to say. Yeah, I mean, always with weight training, you always, occasionally pull a muscle or anything like that. But I've been very fortunate to never have any serious injuries or any back injuries or disc injuries, as far as I know. So just minor muscle aches and pains here and there is really the most I've ever injured myself from weight training. But yeah, the mixed martial arts definitely took a bigger toll on me for sure.
Got it. I see. So let's move on to like your experience with Dr. Rich now going to chiropractic school. How was that experience? Like, well, for example, I'm just trying to understand what are some of the subjects that you're studying in chiropractic school? Like, do you have like just some idea about that? And what do you think was like more defining year for you? For example, for me in physiotherapy school, like the first two years is a lot of like since it we don't have any background in exercise science, we're trying to the first year is basically learning a little bit about like machines and electro stuff, but it's a lot about like just anatomy, physiology, biochemistry, and we really try to start to like tie physiotherapy things in by a third year or fourth year. So that's when you start to like understand a few things of why are we asking all these questions in our subjective history and stuff like that. So for us in physio school, especially in India, we start like those light bulbs start to go off by like our third and fourth year. But I'm just wondering how your experience at chiropractic college was.
Yeah, so for me, like the most impactful courses were probably orthopedics because I enjoyed it so much. I thought orthopedics was awesome. It really let me put things together. Because when you're doing orthopedics, not only are you trying to test tissues, but if you understand what you're testing and how you're testing it and what you're trying to accomplish, if you understand those three things, you really have to put both anatomy, physiology, pathology together. And that's what I love most about it. It's almost like you're problem solving. And that's when things really started to fall into place for me with orthopedics in particular. because with anatomy, the way we're taught anatomy was very, in my opinion, at least, very binary, origin, insertion, function, nerve supply, and then just repeat it for hundreds of muscles. But it doesn't really teach you how things interact, right? At least the way it was taught to us didn't really teach us that, right? How things work together, how movement affects certain abilities in other parts of your body as well. And then with orthopedics is really when things started to do that, essentially fall into place and see how things work together. But it was really once we started working with patients that everything actually made a little bit more sense. But it was almost like a disappointing kind of sense, because you start to realize that most of the patients that come through our clinic don't have orthopedic problems. And so orthopedic testing, is usually negative, 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 right? If you're actually testing what those orthopedic tests are indicated to test, right? Most cases are all negative.
Right.
And so when I started seeing that, I'm thinking, well, what the heck is going on? It's all negative. What am I supposed to do then?
Right.
That's when I had to think and change sort of like my mental paradigm and say, okay, well, I'm not treating orthopedic problems. Let's see what is going on that isn't orthopedic. And that's when I started getting more into, fascial lines and fascial planes, how things interact. And then I started considering more, the person's activity through their life and their job and their occupation and their lifestyle, because those are really the things that, at least from my experience, give me the clues to determine what is going on and how we should move forward. So it wasn't until fourth year, I think, that things really started to almost fall into place and for me to develop into who I am. But prior to that, it was just, following the textbooks, which unfortunately, they don't teach us how to apply that in a clinical setting very well, at least from my experience. But, for anybody who's a student, I think the important thing is education is one thing, but I think what really sets you apart is what you do outside of your education, right? Because if you just base your entire practice on what you were taught in your school, you're going to find that you'll be quite limited, right? So I think it's very important for young practitioners to really, make the effort to think outside the box and try to learn to interpret things themselves.
Absolutely. Yeah. And for me, that movement that you're talking about, like anatomy, just learning anatomy for the point of anatomy about insertion origin, that moment for me was when I was in my master's program and we were doing this course on, it wasn't FMS, but it was heavily FMS, movement screen bias. And I remember our professor came in and he said, hey, so the way we understand, I guess, knee extension is the main muscle that causes knee extension could be a quad. So you'd always think about quads. But when you're trying to get up from a seated position, he's like, just place your hand at the back of your leg and just feel your hamstrings, right? So he's like, ideally, if you're only thinking about anatomy in terms of my quads are causing knee extension, then you should not feel any co-contraction at the back of your leg. And he's like, feel if you can see your hamstrings kicking in as you're trying to stand up, right? And he's like, that's just a small example of the body not working in isolation, but like there's co-contraction of a bunch of muscles. Your core has to brace before you move, so trying to think more globally than locally. And I find a lot of, at least the way we were trained, was initially just microscopically looking at one joint, So this is how initially I was trained about like 10 years ago. It's like, if it's a knee problem, like, instead of having a broader view when you're getting a bird's eye view on the whole body and other things like, now we know like there's so many other things, not just like the joint above and below, but we are looking at person's like sleep and their nutrition and how are they feeling, are there stresses in their life and stuff. But back then, all we were doing was, if it's a knee problem, we like scope in and zoom in into the knee and do all these tests and try to figure out what's going on with the knee, not even like bothering too much about the joints above and below. But like what you said, right? Like our anatomy was exactly like that. It's like, this is the muscle, this is what it's supposed to do, that's the action, and that's it, right? And I find like after graduating and going through a bunch of courses and slowly understanding these things, that really started to tie all of it together.
Yeah, so you had, it sounds like you had a very similar experience where coming out of school, you're almost blinded to the path of what you've learned already. But I think the older you get, you start to realize that you know so little, and that there's still so much to really know,
Right.
because it's very, it's a bad feeling when you do all these tests that you're taught in school and everything's negative and you're left with a patient still in pain and you don't know where to go next.
Right.
Right. And so it's exactly what you said. You have to learn how to see the person for who they are and not just for the test that you're doing, because then you're lost at that point for sure.
Right. And I did see this, like tying into what you said right now, I did see this, I guess a post on Instagram somewhere by like this really great physio who put a graph of when you first graduate from school, right? And you say, learn a new technique or something, you feel like you know everything. And as you go through with experience over years, you're like, I don't think I know a lot. It's funny how that curve goes. When you first graduate, you're like, now I've like done this. For example, in my case, when I graduated, right through my internship, I did my Mulligan course. So I did like the lower and upper extremity. It was an 8-day thing. So I finished the whole of the Mulligan concept, and then I appeared for its examination. And I passed the exam, and I started applying Mulligan on everything. So just joint mobilizations. I wasn't worrying about soft tissue, not doing these other like exercises. And then for me, it was all about like, if somebody came in with knee pain, I did some joint mobs and they felt better for like 10 minutes. I thought they were better, not knowing that maybe they'd go back home and now the knee would start hurting again. For me, it was like, hey, these guys are getting better. And I was like, I felt like I understood everything. Like, I was like, this is great. I just graduated, all my patients are getting better. But it's so funny now that I don't even do as much of the Mulligan joint mobilization. I'll do it sometimes, but I'm not using it a whole lot. So that's really interesting on like how you first graduate and you feel you know everything. And then as you go by, you're like, everything that I learned was maybe, I guess that's what research too is, right? Like you research it again and you find new things, and a lot of things that you've learned before are kind of outdated, right?
Yeah. And just to add another point on top of what you just said, is there isn't at least so far based on our research, there isn't a particular treatment or protocol that is the gold standard.
Mm-hmm.
Right. So what I'm trying to say is that many things work.
Yes.
Many things work.
Mm-hmm.
Sometimes doing nothing works very well as well.
Right.
And so we have to keep that in mind as well, that it's important to take courses and learn, but not to take everything so literal, right? Like there is no defining, holy grail of treatment seminars, right?
Right.
It's important to just take things for what they're teaching and applying them as you think you can. Because
Right.
Another important aspect is your confidence, right? So if you take a seminar and you're not really confident in that seminar and you don't really believe it, and then you try it on your patients, they smell that lack of confidence.
Right.
And, there's also placebo, which works very well. So as a therapist, you almost have to learn to utilize everything, and confidence is one of them. You have to be confident in your treatment styles, because that will show efficacy, in my opinion, at least. Just like a patient will trust you if you look like you know what you're doing, right? And if somebody trusts you, they're more willing to participate in it as well. So yeah, exactly, right. You got to take things and apply them as you seem necessary without getting too biased, in my opinion.
Absolutely. And one of the principles that I feel like I was going to make maybe some kind of a social media post on that, and it's been going on in my head for a while now, is this is my current thought process on like whatever I've learned so far. I remember when I was back in school, a lot of times for me, it was just this, right? Somebody came in with knee pain, I'd do a bit of my assessment, but then for me, it was, I need to apply this technique to see if it gets better. So I was like heavily like technique focused or treatment biased. And a lot of my professors would keep saying, it's like, don't worry too much about the treatment. Like make sure you know what's going on. The clinical impression or like you understanding what this problem is more important than you rendering the treatment. And at that time, I didn't understand this. I was like, well, my patient has to feel better. I think that's what's most important. But over the years, one thing that I've realized is that it's the concept of like, do you think you need to be a specialist or a generalist? And in my mind, what I've realized is that and it doesn't hold true for everything, but what I feel is you should be a specialist in the way you're trying to understand a problem and get a best idea of what's going on. And then in the treatment part, you could probably be a generalist because you don't have to be super specific. Just like you said, it's not like your technique or your hands-on treatment is the only thing that might work. Some people might do something totally different, and that can help as well. Just for example, a point being, what I could do with maybe down regulating a muscle with hands-on treatment could also be done with needling, right? Or acupuncture.
Yeah, totally.
Mhm.
Yeah, 100%. And sometimes, even the environment, like I have multiple clients that are, fibromyalgic, hypochondriac. And so you have to be very, gentle in the way you do things. And as soon as you bring that sort of elevated, heightened, sympathetic atmosphere down, it's almost like the treatment now works.
Mhm.
Right. And I find that to be such a fascinating thing to happen because it's not about what you've done clinically, it's just about the environment. And that you can see in certain populations is so important for treatment efficacy. And so sometimes, we're on Instagram and we see all these rehab exercises that are so complicated. And for some reason, we think, or a lot of people think, that efficacy is a function of complexity. And it's not whatsoever, right? Because something doesn't become more efficacious because it's more complex, right? That's not true. And so sometimes the efficacy is really just dependent on whether what you're prescribing is actually doing what it's intended to be doing. And so sometimes I run into this issue in terms of diagnosing because, you know, as a chiropractor, we're primary healthcare provider, so we diagnose patients. But like I said before, most people don't have orthopedic problems. And so somebody comes in with knee pain, and sometimes they come in told, oh, it's patellofemoral pain syndrome. Oh, it's ITB. Oh, it's this. But it doesn't really seem like it's that. And so, in my opinion, it's worse sometimes putting a specific diagnosis on something that may not be, right? So I have a hard time sometimes struggle sometimes diagnosing things that are more functional based
Mhm.
because I don't like to put diagnoses and create sort of like this mental concern with patients. And so I try to word things and explain things more from a movement point of view or performance point of view or joint point of view versus just putting a word that they can go on Google and search and then find all these crazy things about it. Do you sometimes run into that as well? Like the diagnosing part sometimes creates almost like a confusion,
Mhm.
and sometimes affects your treatment as well.
Right. Yeah. And just to that point, I remember. So basically, there's this really famous running physio out of Seattle, and he used to. When I first moved to New York, he used to live in New York as well. And I just graduated. And I sent him this. I wanted to work with him, so I sent him this email saying I'm a certified Mulligan practitioner. It's funny. Like, and I was like, I want to work with you. It seems like you have a good understanding on, and you see a lot of people in the running field and stuff like that. Long story short, I didn't work with him, but I followed a lot of his work. And this is what he does too. Like when he's dealing with running injuries and people come with their own research and they'll say, I think it's patellofemoral or ITB syndrome or stuff like that. He'd look into it. And what I've understand from his hours of like lectures and teaching, he's like, he doesn't like to put a name on this thing just because what I've understood is we try to name these conditions for our understanding, but not necessarily what's going on. And he just say, I think this is a load management issue. You've been like, I love the fact that he simplifies things so much. He's like, I think you've been running for 6 days, right? And about 20 kilometers, whatever, 20, 30 kilometers, and you're just putting a lot of pressure on your knees and the front of your knees is irritated. Just take a little bit of a break. If there's something he has to do in terms of analysis of movement and stuff, he'd probably do it. But this seems more like a load management issue where you're not giving yourself any break and you just have some pain on the side of the leg. So that's exactly what he'd call pain on the
Yeah,
side of the knee, and that's it.
that's exactly what I mean. And I'm glad you mentioned that because I really appreciate that, right? People who explain things that way.
Right.
Just to give you an example with a patient recently, it's a patient who, he's a bit fibromyalgic and to the point where you can't really conduct a proper knee exam because everything essentially hurts. Went to a physiatrist and the physiatrist diagnosed them with patellofemoral pain syndrome. And I thought, how in the world did you even test for that? Because everything uncomfortable. So then the next day, this patient comes in with this super fancy brace to support the patella and all these gadgets and whatnot. And I'm thinking that could do more harm than good
Mhm.
because now you're limiting normal movement in a joint that was normal. It was just hypersensitive, or maybe there was psychological hypersensitivity, whatever the case might have been.
Right.
But now we think that that's the problem, and that's what we're treating with all these gadgets, which could be more harmful than good.
Yeah.
So, right, that's the problem that having a diagnosis that people can just Google search and treat on their own sometimes creates as well. So, yeah, I couldn't agree more with that statement. That's cool. Yeah.
Absolutely. wanted to delve a bit now and to move on to other things. So I feel like this is something that I've been meaning to ask you for a while. Like, not only do I love your, I guess, rehab principles and everything you're doing, but I also want to ask you a bit about like everything that you're juggling with, right? So you have a business, you're a business owner of a office here in Ottawa, rehab facility, a chiropractic multidisciplinary office, let's say. You also teach at Ottawa U. So you're a professor at the one of the courses there for medical students. I just wanted to talk about how are you juggling all these different hats, and how do you manage like being a business owner, providing the best care to your patients, helping students at basically medical students who are about to be doctors, right? That is great.
Yeah. So I could talk for 2 hours about this because you're essentially asking me, what my vision is, like what I want to do with my life, and there's a lot to it. The clinic aspect is the business owner side is something that I'm very passionate about.
Right.
I love the entrepreneurial side of things. I think it's very, in a way, it's fun, right? Growing something. But my goal for Ottawa Health Performance and Rehab is to create a facility that focuses on reputation and not revenue, right? Reputation is by far my most valued aspect of anything of me, right? Because I unfortunately, when care is private, people become obsessed with the numbers, right? Mm-hmm. And to me, I don't need to be making $300,000 a year, right? I don't need that much money. I'd rather have a clinic that is doing what is intended to be doing. Is following up-to-date clinical research, is following good treatment protocols, cost-effective treatments, and show that we chiros, physios, massage therapists can work with the medical community. And so the reason why I'm very focused with the medical school at Ottawa, which, by the way, I'm not necessarily a professor there because I'm not teaching, but I am the coordinator for one of the electives, which is an interprofessional elective. Mm-hmm. So this elective is offered to medical students at the University of Ottawa. And when they take this elective, is usually internal medicine or family medicine students who are probably going to be family physicians. They get in touch with me, and I basically coordinate with clinics throughout Ottawa to provide 2 weeks of a shadowing experience for these students. Now, my clinic is one of the primary teaching clinics, so we have medical students shadowing me around for 2 weeks, or other practitioners there at the clinic as well during that time frame. And the goal is to essentially show medical students what we do and how we do it. And so the reason why I'm taking charge of this is because I get to select where I send these medical students. Mm-hmm. So I'm very slowly, at a very, very minuscule level, changing the opinion of future MDs, because we know what some MDs say about chiropractors, sometimes even physiotherapists, right? But you'd be surprised how little medical students know or are taught about things like occupational therapists, right? Or osteopaths or chiropractors, naturopaths. They don't get taught these things. So how can we expect them to refer to those people, those practitioners, if they have no idea what they do? And so that's what I'm trying to do here. I'm also trying to make a study out of it. So I have a validated questionnaire that I'm sending to these students before and after the two-week shadowing experience to really capture their changes in attitudes and perception regarding these professions. And you would be surprised at the impact it's had thus far. Basically, they all go from a 20% likelihood of referral to 100% likelihood of referral. Like, it's unbelievable. And the comments at the end are always saying, listen, every medical student should take this elective, because now, even within 2 weeks, they get to really appreciate what you and I do, right? And they get to see what patients say. And the good thing is that the sort of values and the treatment style that we have at our clinic, it's on average, we're seeing a patient 4 times per year. That's what our average is right now, is 4.1 visits per year, which is unheard of for chiropractors, because chiropractors are notoriously seeing people, twice a week for months sometimes.
Right.
And so just them seeing that alone is super valuable, because it's also a financial thing for patients, right? Sometimes patients don't have the finances to go 10, 15 visits. And so for me, it's very important to bring those visits as low as possible, because that's how I was raised. I didn't come from money. I could never afford a chiropractor or physiotherapist. So I wanted to give an opportunity for everybody to be able to essentially receive the care without being broke, right? So that's why I'm trying to do all these different things to try to create basically the ideal clinic, 5, 10 years from now. It's going to be slow process, but we have to start somewhere.
Yeah. And I definitely feel like, I think your heart and mind is in the right place when you like, the thing that sticks out the most is what you said. Your average visit of like 4 sessions for some patients in a year is remarkable, because like you said, what I've seen a lot of like traditional chiropractors and even physiotherapists do a lot is where they follow a different, sometimes we call them as like more like mill physios, where you're coming in, or offices where you're coming in and seeing people for 3 times a week for 6 months. And then you also have like this maintenance program where they have to come see you, where we are making them dependent on us, where if you don't come in to like see us, like something might like your back might slip out or something might happen, and that could be catastrophic. So making that patients dependent on you. And I find like that's one of the things that is so different about Ottawa Health, is that we're not promoting that thing, right? That it's about like getting the patients as independent as soon as they can, and not focusing too much about like how many visits they come in for.
Yeah, 100%. And you brought up a word that I wanted to ask you about. What's your opinion and sort of approach to maintenance care? Is that something that you think people should pursue? Do you think it's something that has efficacy? What's your opinion on that?
So for me, maintenance is, I generally, by the end of my plan of care, I want to show them enough tools to empower them to take care of their own maintenance. And every once in a while, those tools are not enough. Like if say you had an incident where you injured something, where you tried those tools, I almost call them as like people reach out for their medicine bag and, like at home and get a Tylenol. These exercises are maintenance exercises that would help you reduce the chances of injury, or well, nothing can prevent injury, but like reduce the chances. But that's really maintenance care for me. And then if say, hey, you tried everything that I showed you and it didn't work, I'm more than happy for you to come back and see me. But it doesn't have to be every week for like forever. That's how I think like maintenance care should, the patient should be the driver position here, and we are the co-drivers, which is guiding them through the rehab process. And every once in a while, if they come to see us back for the same thing where they couldn't manage their symptoms, it's just that I think we have certain more tools in terms of like needling, taping, just our expertise, just doing some hands-on sometimes, they don't, mostly our patients don't require hands-on forever. But hey, if sometimes you tried those things and it didn't help you and you need some hands-on, sure, come on back. And that's how I think about a bit of maintenance program.
Yeah, I couldn't agree more. I think unfortunately what we see often in clinics is doing the same stuff for maintenance care.
Mm-hmm.
That, in my opinion, is not what maintenance care should be. It's not about doing the same stuff, because what are you really maintaining?
Right.
From a chiropractic maintenance point of view, there is zero research to say that getting your spine adjusted from top to bottom is going to be beneficial long term. But the way that I see maintenance care is there's always things to improve. And so when somebody comes to me and they say, no, I feel great, I don't just go, okay, lay down, crack, 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 crack. No, I'll say, okay, let's go from a top to bottom assessment very briefly, maybe just range of motion, asymmetry, assess for tightness, dysfunction, a little bit of provocation, to see what we can improve. That may not be painful or may not be causing you any grief, but perhaps it can be a little bit better. So some of the areas that I always focus on are transitional areas, right? Upper cervical movement, because if you don't have proper upper cervical movement, you're not going to have good global movement, period. So let's assess that, see how that's doing. If that's fine, how's that CT junction? If that's fine, how's the scapulothoracic movement, right? How is the glenohumeral movement, right? And you can go on and on. And so from a maintenance point of view, there's a lot that can still be done that can perhaps provide a lot of benefit.
Mm-hmm.
And so that's how I see maintenance care. And I don't know if that approach is necessarily evidence-based from a preventive point of view, but at least I'm capturing objective measures.
Right.
right? It's not just like blindly, okay, lay on a table and let's go over the same choreography, right?
Right.
It's actually trying to capture some form of change.
Mm-hmm.
And I think when people see that, oh, this is a little bit limited and wow, this is a lot better now, I think they really like that because now they see and feel a change.
Right.
So that's how I see maintenance care. That there's a lot to do, but I think we just get a little bit lazy when people say, no, everything's fine.
Yeah.
You know what I mean? When people say everything's fine, some people just get lost. I don't know where to go, right?
Right.
And so we gotta dissect a little bit more is what I think.
Right. It almost sounds like your maintenance care has like mini goals in it itself. Like it's not like, hey, you're good now, just keep coming and seeing me. You have these little goals with your maintenance care.
Yeah. So part of the reason why I started thinking that way is because before I bought this business, Ottawa Health, I started a separate business where it was a mobile chiropractic service, but only for retirement homes.
Right.
And it was a bit of a community service. Like it was very affordable, like the cheapest I'll ever probably charge anybody because these retirement homes were very underserved. Like there was nobody there giving them treatment for anything. They had a family doctor and they had a chiropodist at most locations, but all these people were just living off medications. And the one thing that I started to notice that frustrates the elderly the most is when they lose the ability to do the things that were once very easy. You know, oh, I can't scrub my hair anymore. Oh, I can't put on my bra. Oh, I can't tie my shoes. Those are all mobility based functions.
Mm-hmm.
And so when I say exactly what I just said to those patients who are feeling, perfectly fine, right. I'll say, but look at your arm flexion. It's so limited. Like you're over here when it can be back here. How about we improve that? Because you can still improve it even though you feel like you're already stuck. That to me is maintenance care, right? Preventing things being lost.
Right.
So that's where my approach sort of changed a lot, is seeing the elderly. I learned a lot from the elderly, bedside manner, palpation skills, discomfort, listening, right? You learn a lot when you pay attention to certain populations. And that's one of the things that I learned about maintenance care is preventing that from happening, which is, in my opinion, is mostly mobility based, right?
Absolutely. I wanted to talk to you a bit about something which I've been wanting to ask you for a long time now. I shared one of the posts today where you had a picture with a famous Hollywood star, and I wanted to talk to you about like your experience working with, say, a patient of, I guess, that status, and I had some certain mini questions that I want to throw in there. For example, like, do you feel working with a patient like that changes the way you treat and stuff like that? Whatever you can tell us about the whole experience, right? That would be great. It's just something interesting.
Well, by far, it was the coolest experience I've ever had. It was awesome. I won't get into specific details about, the whatever happened.
Right.
But, I did meet Mel Gibson. We'll word it that way. And at first, it was extremely intimidating, of course.
Right.
But just to give you an idea as to how this even happened,
right.
I thought somebody was pranking me.
Okay.
I called my girlfriend and I said, are you pranking me? Am I going to be on the radio? Because why is this person calling me? You know what I mean? And so long story short, what ended up happening was Mel was filming a movie here in Ottawa, and he's always been a big advocate of chiropractic care.
Okay.
Like, he's very vocal about, seeing chiropractors and having a lot of efficacy from them. And essentially as part of his health routine. But, when you see a name like that coming through and shaking your hand, it's just the most intimidating thing. But, he's a human too. Everybody's a human being. And I think like once you get the nerves out and you just see them as a human being, it's perfectly normal, just a normal interaction. But no, it was the coolest experience ever. Mel was an awesome guy. Which, by the way, the picture and everything that I talk about him, he consented for. He's aware that obviously there's a picture that was put online.
Right.
But yeah, I really appreciate how down to earth he was.
Right.
And it was just fun. Ironically enough, the week before I met him, I watched one of his movies, Hacksaw Ridge, which was this like war movie. I'm a big fan of war movies.
Me too.
And so I had just seen that movie.
Right.
And that same week, I listened to the podcast of Joe Rogan and Mel Gibson. And so he was talking about stem cells and all this stuff that I'm very interested in as well.
Yeah.
So, we talked so much, we talked about stem cells, and I kept asking him, listen, man, you got to tell me how you film those movies. Like, how do you make those explosions? And all these people, like, how big is those filming studios? And he told me that whole movie was basically filmed in like the size of like half a football field. And if you ever watch the movie, you would not believe that. Like, it is crazy how they do those things. And so it was a lot of fun. I learned a lot. And a funny little detail about him at the very end, I asked, hey, can we take a picture? Is that cool with you? And he's like, he grabs my phone and then he starts looking for the best lighting as if he's directing something. And he's like, go stand over there. Go stand over there. He looks at the lighting. He's like, no. Then go over there. And then looks at, okay, there's good. Get somebody to hold the phone right where he had it. Then he goes right beside me because the lighting is good.
Right.
It was just funny. It was hilarious having him there. But it was a very, very cool experience for sure. But just to give you an idea of how that all happened, okay?
Yeah.
I learned a huge lesson from this.
Right.
Just to give you an idea, this happened about 8 months into starting my career. Like I had just graduated. And so everybody else at the clinic that I was working at the time, they had 20 years of experience, and they're thinking, why the heck did this guy who just graduated get referred like that?
Right.
And the lesson that I learned is that you just never know who you meet. And so treat all your patients like they're your first patient.
Right.
Because what ended up happening was, I went out of my way for somebody, and completely out of my way. I won't get into much details, but this person was incredibly grateful and referred, a bunch of other people who weren't getting good care, in my opinion.
Right.
And that, again, I treated them like they were my first client and loved it. Turns out that this lady was the friend of this lady who worked in costume design, and Mel was filming a movie, and something was happening, and then they said, look, you got to meet this guy, Dr. Raigoza. And that's how it all happened. And so it's a small world, you just never know who you meet. And so it was an incredible experience for sure, but definitely taught me to appreciate everyone who comes through your door more than I did already, of course. But it was fun.
What a cool story, like to be helping, but that's great. Like sometimes things happen when you least expect them to. I'm sure when you were helping that person, you were not thinking about Mel Gibson coming through your door.
No,
right?
it never would have happened. And as a matter of fact, like that story with the person that I helped, it was just somebody that I saw. It wasn't even a client of mine. And I said, hey, listen, I have an extra hour of my time. I'm not doing anything. Do you want a second opinion? Like, can I take a look and I'll give you my opinion? I'm not going to charge you. I just want to chat kind of.
Right.
And, I gave her my opinion, and she said, you know what, like, you kind of know what you're talking about. Do you mind treating? And I treated 15, 20 minutes of a treatment, and not to, I don't mean to sound like I'm bragging, but it was a very effective treatment. Otherwise, she wouldn't have been able to compete. And so that really made a positive impact, because she had been getting, IFC and hot towels and things like that for weeks, just didn't do much,
right.
And then one treatment, and then she's competing again at a tournament she had a week later, right? So it was almost like a night and day experience. And that was very impactful, right? I didn't make $1 from that consultation, but again, reputation is what I'm after, not revenue. And that was a living testament that reputation goes a lot further than the $100 I could have made by charging that patient, right?
Oh yeah, absolutely. And also I was just wondering, since Mel Gibson, I guess, sees so many, like you said, he's a big advocate of chiropractors and he sees a bunch of people. How did you feel generally? Was he receptive to like some of the suggestions that you were giving? Were you concerned about all these different practitioners saying different things? And I'm just wondering how was his response to whatever like suggestions that you gave him?
No, he was awesome. He was open-minded.
Okay.
Right. And I think that's very valuable, right? Because if somebody, you might have had this experience as well, where somebody went to a particular practitioner and then they come to you and they say to you, look, Abhi, this is what this person did. Can you do it? Right? Like that is already almost not taking you as a practitioner.
Right.
Right. So I really appreciate when people don't do that.
Right.
And they say, look, I'm here because I got recommended to you. What do you think is going on? right? And that's the vibe that I got, and that is so cool to get. I think that's so valuable. And I'm sure you get this too when people come already diagnosing themselves, like, Abby, look, this is what's going on, and this is what I need to do, and you're like rolling your eyes. Okay. You know what I mean?
Yeah, it's when somebody comes in and says they want a particular kind of intervention from you, right? So like, can you just do that, and that's it?
Yeah. So it was very cool, being open-minded and just letting me be who I am, essentially. I think that's super cool.
Absolutely. And finally, I feel like I could sit here and chat for you forever, but like, I know I've been keeping you on a Sunday for some time, but I did want to ask you this one more thing about the recent graduate award that you got, which is like really impressive, like with everything that you're doing. And that's one of the reasons why I want to tie all of these things together. Running your own business, especially during these difficult times, providing the best care, like seeing some of these like, A-lister patients, then trying to like, be a coordinator for a school. And then you also got this award, right? Could you talk a little bit about what's going on with that?
Yeah. So basically, it's an award that's given to a chiropractic graduate that graduated within the last 5 years. It's given to one chiropractor per year by the Canadian Chiropractic Association. And so, it's a fairly, I didn't even know about the award, to be honest. So it was always a nice surprise to be told about it. But basically, I try to be very involved. And I think somebody just saw that, enthusiasm, because even when I was a student at the chiropractic school, I was very involved. Like, I ran 3 clubs. I used to teach soft tissue. I was a tutor for the previous years. I used to teach orthopedics. I did a lot of stuff involved. I like to be very busy.
Right.
And I think though that just kind of set me up for it. But I think what really set me apart this year for that particular award was what I've been doing with the medical schools and what I've been doing with the community. You and I have talked about the community initiative where, if I have an extra hour in my schedule that I'm not doing anything, I offer it for someone who can't pay for chiropractic treatments. At least I'm making a positive impact. I'm helping somebody. I'm not losing any money because I'm not doing anything that hour anyway. And, this person then becomes an advocate, right? And so it's almost serves like a multi-purpose. And I think that's what really encouraged me being the recipient of that award. But basically, it's an award that's given to a graduate that's just demonstrating potential and has done a lot in the short amount of time that they've been a chiropractor already. So it's always nice to receive those little appreciations, of course. But yeah, that's really all. I'm not really sure exactly what it was that earned me the reward, but I think it was a combination of all the things that are going on.
But I think that's what lies at the crux of being a healthcare practitioner too, is that need to go out and help people, right? It's not about, generally you'd never hear people like, I want to be a doctor because the first thing is not because I want to make a lot of money, right? It's always, if you ask anybody who's a healthcare provider, the first answer hopefully should always be, hey, I just wanted to help people, somebody help me, or, I wanted to provide better care, or just go out and help someone. It sounds like you, with your community, like approach towards helping people who need that care is pretty much the crux of what healthcare should be, right? That's where it should come from. It's just, you trying to help people who probably cannot get the kind of care. And I think like you providing your kind of services, which is not like, adjustments and you're out of the door, like you spend some time with your patients. So that's great, like to provide that high quality care, where you're not even like, as much concerned about, I guess, like making money out of it, but helping is really, I get in my mind, truly the crux of like healthcare and why you want to help people in the first place.
Yeah. Thanks, Abby. Money will come, right? When you do something well and good, money will come because people will seek and people want to support those kind of businesses. And so, I'm not focusing on the money right now, but I have no doubt that it will come.
Right.
And exactly, right? Like that reputation part and the community service is really what will hopefully set us apart. But unfortunately, when things go private, they become more heavily influenced by money. Right. Especially recent graduates, right? Like my first month working as a chiropractor, my entire first month, I made under $1,000. Right. And that's after 8 years of school. Chiropractic alone costs $100,000 tuition, like a lot of debt. and the first month you make $1,000 and you're thinking, man, this is rough.
Right.
So it's very easy for people to drink the Kool-Aid and, go down that rabbit hole of, rapid treatments and high volume clinics, because they're the ones that are going to pay off the student loan very quickly.
Right.
So, unfortunately, recent graduates are put in a very uncomfortable situation that they're broke, right? And the cities that we live in, like the chiropractic schools in Toronto, which is one of the most expensive cities to live in.
Right.
And so you need to hustle like a lot. And so it's very easy for people to become derailed and, follow that high volume, high income style of clinics.
Right.
Because it's expensive being a chiropractor, right? Very, very expensive. So it's unfortunate, but it is what it is, right?
I see. Yeah, absolutely. And finally, before we wrap this up, I want to just, I find like, I don't like asking such a broad question, but anything that comes to your mind in terms of any kind of advice that you have for, I guess, any chiro or physio students who are either about to graduate or who have just graduated and are a bit confused on, like, I guess, like for me, it was initially when I graduated, not having the best outcomes, but then, choosing the courses and stuff like that, or just feeling a bit overwhelmed with everything you learn in school. And then you go into the office, into the trenches, and you're trying to figure stuff out. I know it's really broad on like what advice you'd give them, but anything that comes to your mind or new graduates who might be looking into this or seeing this podcast?
Yeah, 100%. That, learning shouldn't stop when you get your degree. Like it shouldn't, it can't, right? Because then you're stuck. There's many things that you can learn to make you better in many different ways. There's a book that I highly recommend for people, or there's two books I highly recommend to people. One is How to Win Friends and Influence People by Dale Carnegie. It's a classic, beautiful book that will help you not just as a therapist, it'll help you as a human being.
That's my dad's favorite, by the way. Sorry, I had to interject.
Sorry?
That's my dad's favorite. Like my father, since I was a kid, he's always been pushing that book on me. By the way, I didn't read it, but when he hears that, he's be like, "Hey, I told you, man, so many
Oh,
things."
that's funny. Yeah, very good book. Very valid, a lot of valuable lessons. And the second one is the E-Myth, because the E-Myth, for those that especially want to be business owners, which most physios, chiros, to some extent are a little bit entrepreneurial in nature, you have to put on different hats, right? And he talks about 3 different personalities that you need to be essentially to be successful. One is what he calls the mechanic, which is what you do as the profession, right? What you're doing. You also have to be the entrepreneur, how to grow your business. And you also have to be a manager, know how to manage people. And so learning about those 3 things happens in your own time, because there isn't a program in school that teaches you how to do that. I had this discussion with some of the curriculum committees at the chiropractic school. And I always said to them, like, listen, how come you don't teach us about business? Like, why don't you teach us about a spreadsheet, how to do payroll, or how to even read a contract? And they say, well, we teach you to be chiropractors. Whatever you want to do as a chiropractor is not really our concern, right? You don't have to be a business owner. You don't have to hire people. So when he said that, I thought, well, I guess you're right, because medical schools don't teach you how to run a hospital or a clinic, right? Dentistry doesn't do that either. And so I kind of understand their point of view. But that's my point, that you have to learn different hats. You have to learn about different roles, which unfortunately isn't taught in school. So if you learn a little bit about entrepreneurial and running a business, then perhaps you can provide a better quality care and still make the same amount of money, right? It's about a balance, right? And doing things in a way that is both beneficial for you, your patients, and doesn't perhaps get you in trouble someday. So yeah, my piece of advice is just to keep learning and think outside the box, right? Pick up an accounting textbook, pick up a, employment law article or something like that, because those things will definitely help you out in the long run.
That's awesome. Yeah, that's some good advice. I feel, again, I still have so many things I could ask you, but probably I wouldn't want to keep you for any longer. But
I will keep chatting.
Yeah, absolutely. But hopefully I can get you back on the podcast once again.
Anytime, Abby.
That'll be great. Any plugs for social media and stuff like that?
Yeah, I mean, I'm always happy to, have more followers. Anybody who's interested in sort of the stuff that I teach and talk about, feel free to follow me, Dr. Rico. And on Instagram is usually where I post my content. I've been a little slow in posting content, but what I'm starting to post more now is I like to show cases and discuss cases. And so, you'll be able to see like the progress that I have with some clients. I've consented to share their progress on social media and whatnot. So yeah, anybody who's interested in learning a little bit about how I do things at the clinic, yeah, feel free to follow me on Instagram.
And I'll add the links there too. How about like Ottawa Health too?
Sorry?
So how about the office itself? The we can probably promote the office Instagram as well, right?
Oh yeah, of course. So the clinic is called Ottawa Health Performance and Rehabilitation, but our Instagram tag is just at Ottawa Health. Yeah, feel free to follow us there as well. Less of that clinical content I was talking about, but you'll be updated with our progress. There's a lot of changes going on with the clinic. We're in the process now of hiring a physician, and then hopefully by the end of summertime, closer to the end of the year, we'll be able to have family medicine, chiro, physio, massage therapy, naturopathic medicine, and yeah, keep growing, because I'm a big believer in medicine as well. I'm not anti-medications by any means. I think everything has a place in health, and that's where I want to take us, right? Really integrated with the health community. So yeah, give us a follow if you're interested to learn more about our progress in our journey, and hopefully you'll start seeing our name pop up throughout the city a little bit more frequently.
Absolutely. I 100% feel that's going to happen. It's just a matter of time. And also, just on a side note, before we close this, do go on that Instagram page, because the recent post on that was exactly talking about like squat and like the femur, the anatomy of the femur and why everybody cannot squat. So exactly the same. So if you want to know a bit more about that, just definitely go onto the Instagram page and you'll get some more idea about what we were chatting like some time ago on the podcast. But finally, I'd like to thank you, Dr. Rich, for coming on the podcast and sharing like all your experiences with us. I think there was some real gems in there about like the way I feel like people should approach healthcare and rehab, and hopefully people get influenced by that and take something out of this podcast.
Hey, it was a pleasure, and thanks for having me, Abby. I'm always happy to come back anytime.
Awesome. Great talking to you again.
All right, take care, everyone.